And let's move forward to adnexal torsion, which is a common gynecological emergency affecting females of all ages. Diagnosis and treatment are important, particularly in young fertile patients to preserve ovarian viability. The classical parameters include enlargement of the ovary, ovarian mass, abnormal ovarian position in the Douglas pouch anterior to the uterus or in the contralateral side, free fluid in the cul-de-sac, and Doppler vascular flow changes. All have very high false positive rates approaching 50%. The only direct sign, sonographic sign of adnexal torsion is the whirlpool sign. This refers to the sonographic appearance of the ovarian supporting system, meaning the ovarian ligament or infundibulopelvic ligament twisted around its axis. By moving the probe back and forth along the central axis, the picture produced resembles a whirlpool or spiral. As you can see here, you can see very well here the whirlpool sign. This is without color, and here is without color. You can see the pedicle twisted with in the form of whirlpool sign. Valsky and Yagel have further evaluated it in a recent article and found that the addition of sonographic whirlpool sign to the preoperative sonographic evaluation of patients with suspected torsion appears to improve the rate of true positive diagnosis as confirmed by laparoscopy. As mentioned before by Professor Golan, isolated torsion can be also in the extreme age group, as in the postmenopausal women. This is a case described in postmenopausal women, as well as in an adolescent virgin patient, which created a diagnostic dilemma. Here is an example of this, and this is a laparoscopy. There is an excellent article by Merlini et al. Published in Pediatric Radiology evaluating the non-inflammatory fallopian tube pathology in children. Due to the lack of time, I won't go through all of this. These are all examples from this article of hydrosalpinx and torsion of hydrosalpinx. And before conclusion, we can't do without differential diagnosis. Do anyone has the idea of what this tree means? Anyone? Pardon? Hydrosalpinx. This is one idea. Another idea? If you take a good look of this tree, look at the face of the baby here. You see the profile? The profile here, the hands here, the legs here, the fetus lying on its back. What do I mean by this? The fetal tree, that it's not, especially in ultrasound, but in every field in medicine, it's not always what it seems like in the first glance. You have to think of differential diagnosis. And the differential diagnosis of hydrosalpinx or of tubal abnormalities include ovarian cyst, which is the main differential diagnosis, pseudocyst, appendicitis, and pelvic congestion syndrome. As you can see here, ovarian cyst is a more rounded lesion. It has complete septa if present, and the ovary is not seen separated. Acute appendicitis can also be evaluated using ultrasound as well as CT imaging. Peritoneal or pseudocyst post-surgery also in the DD, and pelvic congestion syndrome, by evaluating the Doppler flow, you can easily differentiate between tubal abnormalities. And I thank you for listening. I'm driving away.
Before questions are there,